moved ahead to also look at figure 2 that looks at the sub-sector allocations. Again, for the same period, 2022, 2023, and the proposed one now, you will note that there's been consistency in the proportion of an amount of funds that goes to drugs and medical supplies. And I think this is the highest. Of course, followed by healthcare infrastructure, and then there are all the other elements that have been funded. Now, Honorable Chair, when we are looking at this to try and give it substance, we also do believe that the best way to determine the priorities of the health sector through the budget is by going back to the plan that we have put in place. And so I will draw you now to the priority analysis that is looking at Table 3. Table 3 is a synopsis that comes from the 2022 to 2026 National Health Strategic Plan. This is a plan that this government is implementing currently for the health sector. Chair, you may want to know that the plan essentially guides the government in terms of what are the national priorities when it comes to health. And this particular plan has highlighted 4 key areas as their priorities in this period until 2026. The first one being primary health care. The second one being health promotion, third community health, and then you've got reproductive, maternal, neonatal, child and adolescent, and nutrition in there. This particular table also shows, as it came in the plan, what specific goals it in each thematic area intends to achieve. So what we have done as a partner, Chair, is that on the far right of the table, we have then indicated how the priorities through the 2024 budget are looking like against each of those thematic areas. From our analysis, we do not have a problem with allocation that has gone towards primary health care. This budget on drugs and medicines is currently carrying about 23.6% of the the health sector budget towards the same. We are really confident that this pillar would be achieved very well with this allocation. There is, however, a challenge when you get to 3 particular areas, the remaining ones. When you look at the tabulation, you will note that health promotion and community health have not received appropriate allocation according to their need. And this is where our concern comes in. Then when you go to number 4, I think, again, the first 3 priorities there have been well covered with allocations. The budget, however, presents a challenge when we look at the last 2, and particularly this is adolescent health. The national plan puts an emphasis on the need to improve the health status of adolescents, but also to improve the nutritional status of the Zambian population, particularly for children, adolescents, and women. And these areas, like we did indicate, have really not been adequately covered. And Chair, it's our feeling that if these have not really been covered in the current budget, the primary concern is that these are the areas that then are left to partners to fund. And that brings another issue. Sustainability becomes an issue. Because if partners do not have adequate funding, and this funding is not found in our national budget, then this becomes an area that normally suffers. Now, to justify how we are really concerned about this, you see that when we are looking at the health sector performance and looking at, for example, the number of teenage pregnancies, and this is particularly adolescent health, and we're picking it because it's an area that has not been adequately funded in the budget, so we thought we could enhance the conversation around it. If we tracked the previous plan from 2017 until 2021, Chair, you will note that this country comfortably sent away about 11,492 adolescents and young people from school because they were pregnant. Now, part of what are the reasons for this includes the fact that information was not provided in an adequate manner, and that pillar in the current plan is supposed to be covered by an element that looks at health promotion. The one that we are confirming has not received priority. Now, when we sent away that huge number, and that number, Chair, sounds like any other number, 11,000 per year would sound okay until we come to learn these are human beings we're talking about. That's an average stadium filled up in this country with adolescents that are pregnant and not able to continue school. Now, what this government did at a particular time was to also, and this was because of the high numbers of teenage pregnancies, to introduce what we call the national re-entry policy. The policy was coined to be able to bring back learners that would have fallen pregnant, have delivered, to come and continue with school. That table 1, Chair, is also indicating to you that even in the face of this particular policy, we still had only less than half of these adolescents coming back to continue school after they've delivered. One of the challenges this country has faced is that nobody has been perhaps courageous enough to ask what happened to the more than half. If you look at statistics, Chair of this committee, you'll note that others have been pushed into early marriages because we still live in a culture where people believe that when you fall pregnant, then you should be getting married. And so young people as early as 13 and 14 have been pushed into early marriages. But Chair, because we also live in a society that frowns upon those that fall pregnant outside marriage, we've got others that secretly have gone to procure an unsafe abortion, and others have ended up dying. UTH shows a good record of how many of these are dying because of the same. So it's because of this that you see our emphasis on how the areas, the 3 priorities in the table 3 that have been missed in terms of resource allocation that should have been received adequate allocation. Of course, our worry is that when we are talking about them being adolescents and young people, Chair, tomorrow these will no longer be adolescents and young people. These are going to become adults. Perhaps those that would want to sit in the chair sit in the next time because they were educated enough, their health was invested enough for them to be able to complete their education. So, Chair, that is the concerns that we've noted in the budget. But then we went ahead to look at some of the reasons why actually previously young people have not been able to access these services. So on, I think page 9 of this document, Chair, what we did there was to extract, so SAFEDS has been trying to track the quality of services, and we selected a few facilities. Those you are seeing there are extracts of some of the reasons young people are facing when they go to health facilities. So if, for example, today we've got a young person that cannot access services because of distance, then we've got another one that says, I went to this facility and I was just not able to find the kind of family planning that I needed. There's the other one that talks about young people are failing to go to the clinic to access these services because these services are actually being sold. So these are the cases where you're told, we've attended to you, but for this particular medicine, go to the next pharmacy. And that pharmacy is a private one. And we're talking about not everybody in the community being able to access this. What does this mean, Chair? What it means is that if the 3 areas that have not been prioritized by the proposed budget are prioritized enough, then we should be able to see some of these things being resolved. And as it is now, it really becomes quite a challenge. We try to also look at how the previous budgets for 2017 actually to 2020 fared when we are recording these statistics. You note that the funding trend to the sector, the ministry itself, was actually almost maintained. And the worry is that, of course, at 11.8, we are demonstrating the same trend that failed us in the previous strategic plan. We are concerned, Chair, that if then we continue on that path, we may come back here and realize that that 29% of teenage pregnancies that we have now might not have been reduced in any way. That when we talk about a young person that falls pregnant, it also becomes confirmation that they were having unprotected sex. What that means is that they could have also been exposed to other infections. And our budget gets heavy for donor support to be able to support, medicines like ART itself. And we really think that we needed to depart from there. So essentially, Chair, our observations are that the 2024 budget on those particular areas has fallen short of demonstrating adolescent health as a priority, but also that the 2024 budget carries an assumption that might not come out very clear, but I think from the percentage that goes towards health, it then becomes clear that there's an assumption that if medicines and drugs have been funded adequately, it also addresses the unmet need for family planning. And our experience has taught us that that is not the case. Issues to do with family planning and adolescent health should be resourced separate as a priority and based on the needs. If we continue then on this trajectory, we're also afraid that 5 years down the line, we'll come back to still look at over 11,000 of adolescents and young people that are falling pregnant out of school, and these are our children. Now, out of this entire conversation, Chair, we flagged 5 key recommendations for the 2024 proposed budget. The first one is that the government enhances its already demonstrated political commitment in covering first the difference of 3.2% gap in attaining the 2001 Abuja Declaration to the health sector. I know that there's been a debate about when you talk about 15% to health, have you looked at other sectors and what it's consuming in terms of health and everything else? Education is part of those. But Chair, this particular declaration in 2001 gave a complete mandate and responsibility to the Minister of Health and not any other sector. And we are still convinced that the sector needs to take full responsibility for ensuring that the 15% of the Abuja Declaration has been met. Number 2, with the notable gaps in funding health promotion and community health, which is an integral part, of course, of the 2022 and to 2026 National Health Strategic Plan, the health sector should also collaborate very, very well with other sectors. And a very good example is the Minister of Education. The Minister of Education today, Chair, still is implementing the health program that was previously called CSC. It's now Life Skills and Health Education. If we cannot see funding in the health sector for health promotion, then the ministry could also take advantage of ensuring that that platform is used to provide information to adolescents and young people that have been affected hugely with this. And number 3, that in line with the National Health Strategic Plan 2022 to 2026 goal on improving adolescent health outcome, that Parliament should also provide guidance and oversight. Now, Chair, we are making this recommendation appreciating fully the role for Parliament. That oversight is one of them. So that, yes, there's that oversight in ensuring that the CDF that we also appreciate has been increased, make certain contribution at community level towards the implementation of some of the priorities that currently have been missed. And we note that health has not been one of those areas majorly prioritized under the CDF in the past 2 to 3 years. There could be a number of issues that we need to address, including sensitization of the communities. But it really, CDF can be utilized to cushion some of the gaps that we've noted in the 2024 budget. Number 4, with the highest budget allocation among the 3 budgets development and implementation by the government, so from 2022 and now the 2024, that the Parliamentary Committee on Health should provide oversight on, number 1, the quality of services provided. Chair, you might want to know that resource allocation is just one piece of service delivery. We've seen cases where this money does not reach the health facilities. And we really think that this committee would be very categorical to ensure that some of these issues, including the quality of services being delivered, is to the desirable standard, but also that this committee would also work closely with the Parliamentary Accounts Committee in the oversight of public resource management during the fiscal year in order to avoid misuse and misapplication of the sector funds. Now, this recommendation, Chair, comes from the so many reports from the Office of the Auditor General that we have seen, and health has not been spared in terms of sometimes the misapplication of these resources. We really think that if these are resources that are meant for the general public there, this committee would also help us enhance the utilization of these funds through continuous oversight. And number 5 on the recommendation, which is the last recommendation, Considering the proportion of adolescents and youth against the overall national population, subsequent budgets beyond this particular budget must also be developed in line with the set out priorities of the 2022 to 2026 National Strategic Plan on improving adolescent health. Now, what we are noting, Chair, is that the National Health Strategic Plan then becomes a blueprint for identifying priorities and identifying areas that require adequate resources. And if now we see them being missed, then we also become convinced that perhaps the next process of developing a budget should also be informed by the set of priorities in the National Health Strategic Plan. Because every time then we are trying to analyze what are the priorities by the government in the health sector, the only important tool that we use right now will be the National Health Strategic Plan. And we really think that it needs to inform the budget process. So generally, Chair, as we try to wind up, again, we would want to commend this particular government that for the very first time, we have gotten this closer to the Abuja Declaration, and would hope that with support from this committee, we could see trains that actually get us to there. I mean, we could sit one day and boast that Zambia was actually the first one to hit this mark, because a number of African countries are far below this particular mark. Now, of course, we also know that this demonstrates the commitment, the political commitment, a political will by the government to try and continue improving the health sector. And SAFED is one of those organizations that will stand with the government to try and provide that support. Now, like I did indicate, resource allocation, Chair, becomes just one component of providing a service. We would really want to also see that the remaining four processes of providing adequate services are also well implemented. First of them, after resource allocation, would be the fact that expenditure management for this fiscal year needs to be managed very well. Like we did indicate, we've seen budgets on paper, and you go to facilities, even Panadol is missing. So we think that expenditure management needs to be prioritized. Outside that, the performance management that points to the quality of services and products. We really think that this committee plays a very important role in ensuring the quality of the services. But then through the reports coming from the Office of the Auditor General, Chair, we're also aware that at some point internal controls have shown some weaknesses, and this is what allows for sometimes misapplication of these funds in the sector, that also these are plugged off. And generally the last one then becomes the oversight role of this committee. Chair, with that submission, we would want to end here. Thank you very much.
Thank you, Doc. Thank you very much for the nice submission. It's now time for questions from our honorable members. We are going to start from my left. Dr. Katakwe. Then Honorable Chala. Marita, are you going to ask?
I'll ask the last one.
Okay. Honorable Musanje. Honorable Chinkuli.
No.
Would like to ask?
No question.
Okay, let's go in that.
Okay, thank you, Chair, and thank you for the presentation. Just one observation. In fact, two. You have talked about this 11.8% allocation in the 2024 budget, which is closer to the Abuja Declaration of 15% recommendation. Now, looking at the absorption rate of the funds in the previous years to the Ministry of Health, you find that, as you have highlighted in the Ministry, the Auditor General's report, you find that certain funds were not utilized, though disbursed to the Ministry of Health. Then we have this deficit in terms of reaching the Abuja Declaration. I wanted to comment on what happens. Should we keep funding when we are not able to absorb all the funds, and yet we have critical areas that need the resources to be allocated to, which can actually go to my second point, which is in your submission, on page 2, promote traditional medicine and alternative healing system and regulate the practice. So if we are to promote the traditional medicine, we have this other resource that may not be used. As an institution, do you push for either your direct involvement in the promotion of traditional medicine, for instance, the Sondash formula, and the research that has been pending at TDRC in Ndola for some time, and yet it just requires about 5 million to be injected to the next phase of clinical trials. So just comment on those two submissions. Thank you, Chair.
Thank you, Doc. Honorable Chara.
Thank you, Chair. I want your comment. One of our roles is oversight. Okay. Now, what has been going on is that when you come and sit and look at the report from the Auditor General, that means once in a year. Meanwhile, the money has been given to this ministry. Would it be prudent for this committee to be sitting, to be analyzing how they have spent the money with the quarterly? What would be your comment? So that we know how they are using the funds, than waiting for the Auditor General's report the way it is as at now. Thank you.
Okay. Honorable Musandi.
Yeah, excellent presentation. That's really beautiful. I like the analysis of the both the legislation and the policy environment. Very conclusive, and also the build-up of the issue at hand. I take particular interest in the impact on the adolescent health in terms of our children that are dropping out because of lack of health information. Have you looked at what kind of health promotion mechanisms or tactics that could be used to reach out to many more children and to ensure that we can impact on this, like high impact, low cost interventions that could impact on this situation, given the limited resource envelope? We've got a limited resource envelope, so we need high impact, low cost measures to begin to work with. And I think that's something we could do, push at the ministry to ensure that we can begin to work in this area. And then, of course, the Abuja declaration, yes, excellent. We are almost there, and we really commend indeed Cabinet for almost reaching this milestone. However, we also note that when we review the expenses in the past, we find that the burn rate of our budgets is quite low, especially government budgets. And Ministry of Health is one of them. We had a 3.5 billion allocation of drugs, I think, or so last year. No, this year, 2023. And I think we have not, we didn't spend the one for 2022. We didn't finish the one currently. What mechanisms can you help for the ministry to improve the burn rate and reach 100% expense of the allocated budget? Thank you. Those are my two initial questions, Chair.
Okay. Doc, you can answer those three questions. Then after that, we'll give you another chance to 2 or 3 honorable MPs. Switch off your mic.
Oh, sorry.
Okay. Thank you so much, Chair, and thank you so much, members, for the questions. I note that 2 or 3 questions are actually related on the unutilized funds, including the one, I think, from Honorable Musanje. So perhaps we could start from there. So I'll still refer, Chair, to what we've demonstrated here, that really it also becomes our worry that the Minister of Health would have such huge unspent funds and still be able to record such numbers, for example, in teenage pregnancy, because essentially we just didn't provide what was needed. We have made rounds in a number of different facilities. The reality on the ground is that we have huge stockouts, to an extent that sometimes Panadol is not even found at the facility. And our understanding is that this challenge has got only one issue to it. This is a system issue. And this is what we need to unlock. We have funds, and we've got ill health outcomes on the other side. If we had funds remaining and our health is doing very well, we don't have the 11% plus of HIV prevalence, 29% of teenage pregnancy, then we'd say perhaps the ministry is receiving too much money, more than they need. But I think the conversation is different. And that already tells us that the issue is not about how much funds they have, but what type of a system do we have in place that can then ensure that funds trickle down to some of these health facilities. Part of what we showed on the snapshot on page 9 here are narrations from actual young people in health facilities on how they've struggled to get services because these services are just not available. And there's quite a lot of this. How they've struggled to get certain services because this particular health facility has got a shortage of human resource, and so they have to prioritize which areas. Human resource requires funds. Medicines require funds. The challenge here is not really how much money is at the Ministry of Health. The challenge is that we've got a system that is not helping us achieve what we need. And we realize then the power carried by this particular committee in unlocking some of those. Because then that would also lead me to the other question from the Honorable here on then how frequent should this committee even sit to review the reports. Now, obviously by law, the report from the process of audit by the Auditor General is only going to happen once. And we get this report. Sometimes we even get this report very late. And the worry is that by the time this committee is receiving that report, the damage would have been too much. We are really convinced that if this committee provided their oversight role a bit more frequent than on an annual basis, there's quite a lot that would change. I also do believe that this committee has the mandate to actually carry out some site visits in some of these health facilities, the fact-finding mission, to inform the conversations in terms of policies and all that. And I think even previously in our submissions, we did indicate, say, the committee might need to be providing oversight a little bit more frequent than we do now. The time the Office of the Auditor General gives us a report, which sometimes, a number of times, is delayed. If funds had been abused, normally it's not reversing these funds. But the system should look at both sides. How well could we prevent the misuse? Because if this committee actually went to Chirenje Level 1 hospital and discovered there are no medicines, and yet we know that the ministry is keeping a lot of money, then it gives an opportunity to this committee to query what is happening. Why are you keeping money? Chirenje Health Facility has got no Panadol. Then it gives us an opportunity to track where the bottleneck is and be able to unlock it, instead of waiting for the whole year to elapse. And I think the other question was also linked on the traditional medicines, the direct involvement and everything else. We do think that I think the provision of health services should be as comprehensive as it can get, so that we don't build a wall around ourselves on a system perhaps that might not be effectively working. But also, if we invested enough in research, I think it also becomes easier for this committee to be informed on what is on the ground, because there are also times when we've got systems that we've kept for a long time that are archaic and not working, and we're glued to them. But with proper research, then we'll be able to be told, and part of it, like I said, could be fact-finding missions. Then this committee would know where the challenges are. There's quite a lot of, yes, the research that is unfunded. I think we are really convinced that there could be developments in the health sector that could be generated by our own selves. And those are some of the examples that the Honorable Member was giving. But I think that also requires a deliberate effort and not as a by-the-way thing. We think that those are areas that the government should be able to fully support. Honorable Msanje, on the discussion on the kind of health promotion methods, we are fully aware that the Minister of Health has a full-fledged health promotion team. That up until today, I will tell you that that team is stuck if the 2024 budget is not allocating funds towards that particular department. We are asking, so what work do they do? And in working with that particular unit, we've also seen how much of the work in health promotion then has to be supported by other donors, other partners. And what we indicated was, as much as the private partnership with the government is good, we need to look at sustainability. We have seen cases where certain donors have decided for one reason or another, stop funding our ministry, the Ministry of Health, and the consequences have been huge. And this is where we talk about sustainability. We really think that the gaps that we leave in the Ministry of Health budget should be not as significant to cripple the entire operation of the ministry when one donor decides not to continue funding. And this is why we are really advocating for homegrown solutions to resource allocation. Our own budget should take the bigger chunk of the responsibility to fund the health sector. So really the conversation on low burn rates, there's a lot of evidence in health facilities. We have people that die because medicines are not available and people cannot afford to procure these medicines. And yet here there's confirmation that actually the ministry is sitting on a huge portion of fund. I think the two do not relate. And like we said, we really think this is the issue of the system that is not functional. And what we need to work around, especially through this committee, is how do we unlock the bottlenecks and ensure that the funds flow to the beneficiaries. There's really no good reason why we should have an adolescent falling pregnant because they couldn't find a condom or any other service, and yet we've got funds that are stuck at the Ministry of Health. I really do not think that that should be the approach that we take in improving people's well-being. Chair, I submit.
Thank you.
Just a follow-up, Chair.
Okay.
You have talked about the availability of funds in your explanation and yet ill health outcome on the other, and you have alluded to system issues. Would you be specific to some of the system issues, just being specific for the sake of this team, and where do we provide that oversight? Is it on the human resource capability? Is it on the procurement? Is it on what specifically do you mean by the system issues? Just help us. Thank you.
The last one, Honorable Marita.
Thank you very much, Chair. Chair, I want to look at the growth maybe in the quantum of money being allocated towards the Ministry of Health, specifically in the procurement of drugs. We have 3.2 billion in 2022, 4.6 billion in 2023, and 5 billion for 2024, bringing the total to 12.8 billion. This has also gone into increasing funds, introducing new funds for electronic health records, which has been missing for a long time. In addition to an increase on the medical, when you look at the budget for medical equipment, which is 1.7 billion, this is far more than the 870 million which was allocated in 2021 for just procurement of drugs. With this intervention, obviously, correct diagnosis of illness can lead to a huge reduction in the time in the consumption of drugs, because the right diagnosis, right treatment, which reduces the budget on the medicine being consumed. So from a point of perspective, where should we really invest more of this medical equipment? Should it be in the clinic so that we can diagnose rightly when the illness is still in its infancy, or should we invest heavily in equipment like CT scans, which are mostly found in the last stage of healthcare system? So by putting more equipment in the hospitals, big hospitals like QTH, are we really going to sort out the problem of over-treatment due to poor diagnosing at the primary healthcare system? Thank you.
Thank you. Last one from Honorable Musanje. That is the last one now.
Yeah, I think mine is, Chair, just a concern over the wonderful revelation in this analysis of the left out areas in the priority areas of the budget. The left out areas in the priority areas of the budget, as to what measures can be done for us to have these areas covered What would you suggest to have these areas covered that have been left out in terms of budget coverage, since they are very key in terms of service delivery and ultimately in getting health outcomes in line with the universal health coverage and getting quality lives? I just want to hear your final thoughts in that area.
Chair, thank you very much, and thank you, members, for those questions. So, when you talk about a system that is not functional, I'm tempted to think on one that is prominent that all of us, I think, have seen go around. Zambia, in the recent past, has had a serious debate on whether or not we've got medicines in health facilities. So you've got patients that will confirm I'm being retained from the facility because there are no medicines. UTH becomes a greater witness to that, with the pharmacies aligned on the adjacent that are privately owned, and the business that was obviously booming because medicines are not being found there. But then on the other side, we've got Ndeke House that has categorically told us medicines are there. And so you wonder, medicines are there and people are being retained. To me, already that's a good demonstration of how we have an unfunctional system. At some point, we saw this conversation being the issue of, no, it's not us, we've cleared our way, but perhaps it's the team that is supposed to distribute. And the team that is supposed to distribute has also come back to say, actually, we've got nothing to distribute because we don't have the medicines to take to the health facilities. Now, if the Minister of Health has received funds, like we did indicate, these are funds that are meant for the beneficiaries. The very person in Honorable Musanje's constituency that needs this particular medicine. And so if in between there's a block that doesn't allow the passage of this particular medicine to go and reach the common person, then definitely our system has one huge challenge. And I think that's one area really that we might need to try and unlock. I think we need to have a system where the flow of business is efficient, especially for the Ministry of Health. Other ministries, perhaps you might not even want to worry. We are talking about human lives here. And I think that becomes a serious concern. So, Honorable, that could be one good example of a system that has failed the health sector that needs to be worked on. In a number of these health facilities, you'll see that actually if you find adequate medicines, perhaps because it's coming from other partners that are supporting. And that goes even for equipment itself. We really think that that's an area that we need to unblock. Then in terms of the new budget line that is looking at the procurement, of course, of medical equipment and the like. Now, Chair, I think there are categories on how we need to manage our health service delivery. We are very convinced that our big universities like the University Teaching Hospital, the Levi Mwanawasa Medical Universities should be fully equipped, because these are institutions that actually absorb a lot of patients that come from areas where services that are required here are not found. We are convinced that these need to be fully equipped. But I think in prioritizing the needs for everyone and going by the notion that we shouldn't leave anyone behind, we also think that Petaoke General Hospital, for example, should also be fully equipped, because that is also another way we'll try and decongest the hospitals that we have here.
And Chinsali also.
Yes, Honorable Chair. And Chinsali also. I think this becomes very important. A number of times it's not everybody that we even manage to move from the rural part of this country and come and receive medical attention in the facilities here in Lusaka on time, and we have lost lives. So we really think that at the lowest level of health service delivery, this government needs to provide enough equipment to be able to manage certain ailments that need to be managed at that particular level until there's need that others be referred to some of these that we now overcongest. Today you have people sleeping in corridors in some of these health facilities because the facility cannot absorb any more people. So we really think that the distribution should be based on the need. If you heard us share at some point, we did recommend that research is one of the areas that we need to work around, because even the distribution of resources must really be informed by the actual needs and not that those that we assume, because this is how then we misdirect resources. Then there was the last one on the areas, Honorable Msanje, that have been left out. I'm tempted to wonder to what extent at the time the honorable members started debating the 2024 budget comes an opportunity to do some realignment in the funding components within the overall sector budget, because that would have been the desirable thing when there's evidence that certain areas have been missed. Because the worry now we have is that if the 2022-2026 National Health Strategic Plan has targets, and we've got an entire year with certain targets being missed, there's no likelihood that we are going to meet those targets by the close of the lifespan, which is 5 years of this particular plan. And I really think that...
would you be able to propose some realignment which you can give us of some sort, realignment of some sort which you could give us?
Yes, Chair, that is certainly something that we could do and still make a submission. I think the Madam has been very supportive in terms of guiding us. So that's, I think, some submission that we can make in terms of realigning the budget within the sector allocation itself. Then in terms of how well, looking at how well we can manage the areas that have been missed, I think there's a question on on other ways of managing health promotions, which modalities and all that. Chair, experience has taught us that sometimes we need to fall back and learn that certain ways don't work as we thought they used to. Today, as members of parliament, you come from areas that have got very energetic and involved key opinion leaders, the likes of traditional leaders, the likes of religious leaders. The one thing we know is that pretty much everyone will end up in church at a particular time. There's a power of working with structures like the church in pushing the health agenda. There's a power in working with traditional leaders, and I think this is something that we're currently doing as SAFEDs. You should see how energetic the traditional leaders are as champions, but they come with something different. Me talking to my colleague about prevention of HIV will pretty much look like I'm talking to him because SAFED is going to pay me for talking. But if it's going to come from a traditional religious leader that does not have a direct benefit in whether he gets prevented or not, I think that also carries a lot of value, a lot of energy, and we have seen. But also, this is a methodology that is very sustainable, so that at a time, SAFED is not there to fund a community outreach. A religious leader just requires to call his people under a tree and be able to still continue push this agenda. We really think that this is a partnership that we need to be bringing closer. Madam Chair, I submit.
Thank you very much, witness, for the good presentation. At this time, we have come to the end of the meeting. Meeting has been adjourned. But before you go, I'm going to remove the immunity that I conferred on you, so that when you're outside there, you'll be on your own and no one is going to protect you. I thank you.
Chair, thank you very much, and thank you to the members of this wonderful committee. Thank you.